to you, Jenny.
I call the member for Newtown in reply.
Thank you, Speaker, and I thank all members who have contributed respectfully and professionally to this debate. The members for Charlestown, Wallsend, Badgerys Creek, Prospect, Balmain, Bega, Lane Cove, Blue Mountains, Lake Macquarie, Granville, Sydney, Newcastle, Pittwater, Maitland, Ryde, Wollongong, Kellyville, Hornsby, Wagga Wagga, Barwon, North Shore, Upper Hunter, Cronulla, Kiama, Epping, Castle Hill, Wahroonga, Albury, Terrigal, Hawkesbury, Drummoyne, Ballina, Oxley, Holsworthy, Monero, Cessnock and Port Stephens. It has been incredibly refreshing to hear the careful and considered nature of contributions to this debate, and it is amazing to see the quality of debate we can have when members are empowered to share their own thoughts and reasoning behind this. To hear the various views of their local communities and hear the impact that those seeking to shape their views have, both positively and negatively, on their position on the bill, is such a welcome change from what usually happens in this place. It is also a strong demonstration of the healthy strength of our democracy. If only the gallery were filled with people for debates like this, rather than the faux debates of Question Time, where Dorothy Dix's focus grouped crafted talking points and political spin and gotcha grabs rule the chamber. It is possible for a parliament in a minority government to have more of this, and I hope this isn't the last time that we can see this kind of debate take place during this term. In particular, I wish to thank the Minister for Health and the Shadow Minister for Health, who in their contributions have addressed in significant detail how the bill would operate, and indeed the elements of this bill that are no longer included in this bill. From the Minister's contribution, it is so clear that we are in agreement that there is more work to be done to ensure adequate funding of our health services and ensure that they are appropriately staffed by health professionals. And I have no doubt that Dr. Conn, who is in the chamber and has been in the chamber for the whole of this debate, will continue to work closely and indeed advocate with the government to make sure that more of this is progressed. And I wish to echo the comments made by the Minister acknowledging the work of his team and the department in assisting and advising throughout the development of this bill. I want to put on the record my great appreciation for this work, as well as that of Dr. Conn and her team of the Newtown electorate team and her team, who have stepped up to ensure that all members have the information and details that they need to make considered contribution to this debate. There have been significant contributions made by other members relating to things that sadly this bill doesn't do, either through reference to provisions for the first print of the bill that were removed by the Legislative Council, or through repetition of deliberate misinformation about this bill that has continued. As such, I think it is important to clearly articulate what this bill would actually do before we vote on it, and that is to empower nurse practitioners and endorsed midwives to prescribe medical abortion within their existing, highly regulated scope of practice, recognising their extensive training and experience. The Minister, in his contribution, noted the 2024 statutory review of the Abortion Law Reform Act 2019 conducted by New South Wales Health, which recommended the implementation of regulatory changes made by the TGA in 2023 that enabled other healthcare practitioners beyond medical practitioners to prescribe medical abortions. The Minister for Women also used her contribution to express gratitude for those who participated in the statutory review, explaining that it makes sense for us to revisit this bill to ensure it is working as intended. The Greens bill does that and delivers on the recommendation pertaining to the TGA change. This will improve access to abortion and, most importantly, equity of access to abortion in rural, regional and remote communities where it can be very hard to see a GP. In her contribution, the Shadow Minister for Health spoke powerfully about the significance of people being able to have face-to-face, in-person consultation with a nurse practitioner if they are considering having a termination. She highlighted how too many young women in regional and rural locations are prevented from accessing reproductive health care because they are concerned by connections the local doctor, if there indeed is one, might have in the same town. Importantly, the Shadow Minister also emphasised how deeply unfair it is that while people in electorates like hers and indeed mine may have access to essential reproductive care, others in regional areas or in parts of Western Sydney sadly do not have this same level of access. It is notable that in this bill that was introduced as a regional Greens MP, and it is notable that a regional Greens MP with deep connections to her community, including years as a GP and abortion provider, was the person who has brought this through to this stage. There has also been support from many regional MPs across the political divide, in this place and indeed in the other place. From the member for the Upper Hunter to the member for Oxley, regional members have spoken powerfully in this chamber about how healthcare inequality is impacting their communities. I thank them for bringing their voices and stories of their communities to this chamber. The member for Lake Macquarie perhaps put it best when he said that this bill is simply a question about equity. The member for Bega, who has spent many decades providing women's healthcare in rural areas, spoke up particularly compellingly of the complex and life-threatening situations that he has witnessed, when distance and a lack of local services may have prohibited women from accessing the reproductive health care that they required. As the member for Pittwater aptly put it, these are not abstract issues, they are lived realities. Indeed, these are the lived realities many members chose to highlight in their contributions to this bill, particularly those members who represent communities outside of metropolitan areas. The member for Upper Hunter spoke of how in the community he represents, it cannot be overstated how bad the regional healthcare situation is. Many people now travel to metropolitan areas just to see a doctor more easily. And the member for Blue Mountains, a member of the LA Select Committee on Remote, Rural and Regional Health, emphasised that pregnant women still face too many barriers to accessing abortion and reproductive health care, particularly in regional and rural areas. She went on to say that a woman is best placed to know what's right to her, and the Greens could not agree more. The member for Terrigal also underscored the geographical inequity of healthcare access that makes this bill a necessity, saying it is a very different situation outside of metropolitan Sydney when it comes to the availability of healthcare. The availability to travel the huge distances required to access services in regional New South Wales can be a challenge in itself. My Greens colleague, the member for Ballina, and indeed the first ever regional Greens lower house MP in the country, similarly shared that as a regional MP, I can tell you that access to reproductive health is incredibly challenging for women and men in my community. She went on to emphasise that this bill responds to severe geographic disadvantage of those living in regional and remote areas in need of abortion care, who face hours of travel, long wait times, high costs, and these barriers can have resounding effects. Similarly, the member for Oxley shared that for many women, especially in regional towns or remote communities, this bill may be the difference between getting care in days versus waiting for weeks, between seeing someone in their own town versus travelling hundreds of kilometres between accessing safe healthcare or putting themselves at risk. Across the political divide, those representing regional communities have spoken of the critical nature of this bill when it comes to ensuring access, particularly to those in regional, rural and remote communities. Given this, I must put on the record that it was deeply disappointing to hear the member for Wagga Wagga, who I know that many in this place, including myself, hold a great deal of respect for, deny that there are any actual access problems in his community. To deny this when there is no access to surgical abortion across the Murrumbidgee Local Health District, and when the public medical abortion clinic in Wagga Wagga only has a GP prescriber present 1 day a week, is to deny the lived experience of the many people in his community who cannot right now access the abortion services that they need. The reality is, those working on the ground in those communities have advised us that this area is a known black spot for abortion services and this kind of critical health care. As one health practitioner in Wodonga has told us just recently, in listening to the response and the contribution of the member for Wagga Wagga, practitioners in Wodonga see large numbers of women still travelling from rural New South Wales across the border to access both the surgical and medical abortion. Some have travelled 6 hours one way as there is no public providers within 1,000 kilometres of where they live. Another said, "We have seen patients not able to access surgical abortion at Wagga Wagga Regional Referral Hospital, even for non-viable pregnancies. These women weren't able to be seen at Albury Wodonga Health because they live outside the catchment area, so they have had to travel extensively and pay to access the private system. We average at least one call a week from the Riverina needing to access to surgical abortion that we have no option but to direct to the private sector." I absolutely respect that the member for Wagga Wagga has a very strongly held personal position in relation to a woman's right to choose an abortion. But to say that there is a lack of evidence that people struggle to access abortion services when this is the testimony of healthcare providers working on the ground in his area is something that cannot go unaddressed on the record. In a submission to the Legislative Assembly Select Committee on Remote, Rural and Regional Health, of which the member for Wagga Wagga is the chair, an Orange City Councillor outlined how those seeking an abortion in Orange are forced to either wait for a very limited number of appointments at general practices or travel significant distances to urban centres, something that is far from feasible or affordable for many. The member says that the state of rural maternity care and obstetrics issues are more pressing issues, and I gently remind the member that it is possible to care about multiple things at once, and indeed that expanding access to essential healthcare services for everyone is not a zero-sum game. There is nothing in this bill that is at odds with expanding services and supports for pregnancy, birthing, or fertility. To suggest, as the member for Badgerys Creek has done, that this bill focuses on abortion as the primary form of healthcare, end quote, as a substitute for all other appropriate reproductive health is patently false. The Greens absolutely support the expansion of other maternity and obstetrics services, of access to counselling and ongoing health care, and that work must be continued on another day and into the future. Dr. Conn has been working on this particular issue and is very passionate about this as chair of the Birth Trauma Inquiry. I acknowledge, in addition to this, that my Greens colleague has in fact done extensive work in a professional career capacity as a country GP and also as a member of this place on these very issues. As the member for Balmain made it clear, the bill will hopefully reduce the number of heartbreaking experiences of people who cannot access the support and care they need. It is not, shamefully, as the member for Prospect cynically called it, a political stunt to be moving this bill. It seems the member didn't get the memo that the rest of us chose to leave the tedious political talking points at the door when it comes to having a considered debate on this critical issue. I also wish to acknowledge another recurrent theme throughout this debate, which is affirmation of how well equipped, through their extensive, rigorous training and education and their experience, nurse practitioners and endorsed midwives are to prescribe medical abortions. In his contribution, the Minister for Health stressed that nurse practitioners and endorsed midwives are highly respected, highly qualified, and highly trained. The Health Minister emphasised their tough, long, and arduous training. Other members echoed these sentiments, including the member for Ryde, who said that if anything, nurse practitioners and endorsed midwives are overqualified to prescribe an oral medication. Allowing them to prescribe medical abortions, he said, is consistent with multidisciplinary team-based models of care, which already involve nurses and midwives. Indeed, the Greens know, both in the context of this particular bill and beyond, the essential role that nurse practitioners and endorsed midwives play in our healthcare system. We know that they are well equipped to do what this bill will allow, and it would be remiss of us not to take this opportunity to say that it has been fantastic to hear government members acknowledge how crucial and highly skilled these practitioners are. It would be even better if it was paired with giving them the 15% pay rise that they're asking for. I quote RANZCOG, who in their correspondence to all members of this House have shared, and I quote, "The College unequivocally supports the inclusion of nurse practitioners and endorsed midwives in the provision of early medical abortion. Enabling appropriately qualified health professionals to deliver this care is a safe, evidence-based reform and a necessary step toward ensuring timely, equitable and patient-centred access to abortion services for women across New South Wales." In relation to the amendment that has sought to challenge the existing level of expertise and qualifications of these health practitioners that will be moved by the member for Wagga Wagga shortly, RANZCOG further adds, RANZCOG is strongly opposed to the proposed amendment number 1 as it will create significant barriers to nurse practitioners and endorsed midwives prescribing medical abortion. Medical practitioners and pharmacists are not required to complete an additional certification as medical abortion is regarded as any other medication. Requiring additional training for nurse practitioners and endorsed midwives does not align with their prescription of other medications, and nor does it align with legislation in Queensland, Victoria, South Australia, and Western Australia and the ACT. Additional certification will be potentially costly for individuals and New South Wales Health. As previously communicated, there is evidence that provision of medical abortion by nurse practitioners is both safe and effective. Improving access to early medical abortions can reduce later presentations. Before I turn to some of the other misinformation that we sadly heard in relation to this bill, I would like to put on the record and read a correspondence that was received from the Nurses and Midwives Association just earlier today. The Nurses and Midwives Association asserts that nurse practitioners and endorsed midwives are well positioned to provide safe and vital abortion care without the need for further years of experience or training. We identify that there are notably few nurse practitioners and endorsed midwives who currently have the scope of practice to prescribe MS two-step. In order to prescribe, currently nurse practitioners and endorsed midwives must complete an additional 10 continuing professional development hours relating to prescribing and additional research on top of the following requirements which demonstrate adequate preparation for safe prescribing. Completed and approved postgraduate master level program, hold current general registration as a midwife in Australia with no conditions or undertakings relating to unsatisfactory professional performance or unprofessional conduct, and have undertaken the equivalent of 3 years full-time clinical practice or 5,000 hours in the past 6 years. Medical practitioners have had the same prerequisite MS Health Proprietary Limited training removed, so we are of the position that it is an unnecessary step for appropriately skilled nurse practitioners and endorsed midwives to undertake such training. Nursing and midwifery are regulated professions that must adhere to strict standards of practice and codes of conduct and ethics. I understand that this letter has been provided to members, but if any member would like to see a copy of that to be able to engage in that in discussion around the amendments, I would be more than happy to share that with them. I would like now to turn to some of the unfortunate misinformation that we have heard in this place. Sadly, misinformation that has been spread both in the community and that has been further amplified here in this chamber. From the time that this bill was introduced, we have seen anti-choice and bad faith opportunists seize the chance to circulate harmful misinformation and elicit fear throughout our communities. I echo the sentiments raised by the Australian Medical Association that there is indeed no place for misinformation in healthcare, and that in fact these targeted campaigns are damaging to public confidence in vital health services. I want to raise particular concerns with the reference that has been continually made to those who oppose this bill to a paper published by the Ethics and Public Policy Centre. Sounds innocuous enough. This so-called research, which the members for Epping, Castle Hill, Lane Cove, Wagga Wagga, Kellyville, Badgerys Creek and Hawkesbury all cited in their contributions, is questionable, to say the least. The Ethics and Public Policy Centre is a US-based think tank and advocacy group whose findings have been widely and enthusiastically supported by anti-choice groups. The particular paper cited by those opposing this bill was published in April 2025, and it spread like wildfire across anti-choice platforms and in the conservative media. That paper alleged that in a sample of almost 900,000 women who access medical abortions in the USA, more than 10% experience an adverse event, such as sepsis, infection, or hemorrhaging. And we heard all of those members who I mentioned earlier cite this research paper as if it was a credible source. However, shortly after the paper was published, the American College of Obstetricians and Gynecologists, together with other women's health experts, disavowed it as a flawed report and based on faulty methodology. The president of the American College of Obstetricians told AFP Fact Check that the paper, and I quote, manipulated data to drive a myth that medical abortion isn't safe, end quote, and reiterated that, and I quote, decades of reputable peer-reviewed scientific evidence and use of data prove that medication abortion is safe and effective, end quote. A piece in The Guardian yesterday similarly noted that, and I quote, the study contradicts all previous tests of the drug and the resounding consensus in the medical field, end quote. To be honest, there are some members that I listed that refer to that research paper that I would expect more of. Others, not so much. Closer to home, the member for Bega in his contribution cited 3 studies that compared the provision of early medical terminations by doctors and mid-level providers and found that there were no safety concerns with provision by the latter. In these peer-reviewed studies, there were no serious adverse events recorded. There is broader commentary to be made about the cultural moment we are in, indeed, in which bad faith actors love to cherry-pick data from sources purporting to be scientific or rigorous when they are anything but. But that is a debate for another day. For now, I want to acknowledge the considerable community distress that is caused by these campaigns and the harmful and divisive misinformation, particularly purporting to pretend that these kind of medical abortions are unsafe when indeed there is no founding in medical reality or in people's lived experience. The members for Granville, Port Macquarie, Newcastle, Cronulla, Pittwater and Wollongong have all acknowledged how extraordinarily rife and in some cases openly malicious the misinformation campaign in relation to this bill has been. From all sides of politics, members have expressed discomfort with campaign tactics, and the member for Granville has aptly described ones that have amounted to bullying and spreading misinformation and disinformation, not lobbying. I acknowledge that some of this has resulted in unacceptable threats and abuse directed at members from across this parliament, and particularly, shamefully and sadly, the mover of this bill in the other place, Dr. Conn. There is no place for misinformation in healthcare, and the intentional erosion of public trust in vital healthcare services is deeply harmful to our communities and indeed can harm our democracy. I echo concerns raised by the Leader of the Opposition and member for Cronulla, a rare statement from me in this place, I recognise, that this behaviour by some of the people positioning themselves as leading advocates against the bill as brazen bullying and reflect efforts to see the Americanisation of New South Wales politics not infect our democracies here. I note that unfortunately one of the such leading advocates that was indeed praised by a member in this place that is opposed to the bill has actually been banned from parts of the South Australian Parliament as a result of their allegedly threatening and intimidating behaviour of MPs ahead of a vote that occurred in that place. I want to specifically address the hypocrisy of the member for Badgerys Creek in saying there is a great risk for those who speak out against this bill, while thanking by name this anti-choice influencer who has personally organised and encouraged threatening behaviour towards a number of MPs. The Leader of the Opposition and the member for Granville, and indeed the member for Lake Macquarie and Speaker, were right to call this behaviour out, and I thank them, and I know that that feeling of thanks, gratitude is also expressed by my colleague Dr. Amanda Conn. I want to acknowledge particularly the member for Lake Macquarie who spoke out about the impact of the unfortunate misinformation campaign targeting my Greens colleague, Dr. Amanda Conn, and agree with him that this bill is simply a question about equity. It is unacceptable indeed, as we heard by the member for Granville, that any staff member of ours in our electorate office be filmed without consent, as happened in the Granville electorate office, and that is truly disgraceful behaviour. I want to also acknowledge the effect that this has had generally on electorate officers and on our electorate office staff and MPs throughout the course of this bill debate in this chamber. I know that my own electorate office, and indeed many others, have received significant correspondence from the community voicing their views on this bill. And as someone that spent many, many years working for Amnesty International, targeting MPs by encouraging people to email their local MPs, I am certainly not saying that bulk email campaigns are not something to be encouraged. In fact, they should be very welcome. That said, email campaigns that are spreading misinformation, that are threatening, that are bullying, and that are indeed making very concerning claims about what will happen to individual MPs if they speak out or vote in a certain way are unacceptable. It is always important that members of the community feel welcome to engage with their MPs, and I think all of us here would say that we would be very sad if our inboxes were empty, even though we may find it quite challenging to deal with them and the flood of comments that come in. We welcome that, and we want to hear the voices of people in our communities so that we can reflect them in this workplace. But threats and abuse are unacceptable. They are unacceptable towards MPs, and they are absolutely unacceptable towards our staff. In particular, the bullying vitriol on social media by anti-choice opportunists seeking to build their social media platform has been shocking and distressing. These anti-choice figures have sought to create and amplify division and misinformation throughout the community purely for their own self-promotion, to increase their followers and their social media platform so they can indeed benefit from their influencer status. In one of the most extreme examples heard during this debate, the member for Granville yesterday shared that a member of her staff who was on her last day of work before maternity leave was filmed and posted online without her knowledge, without her consent. And when asked directly by the staff member to remove the video, it was not taken down. The open harassment and public shaming of a member of staff who comes to work every day to do their job is wholly unacceptable and points to the increasingly dirty tactics used by these bad faith actors. It also raises genuine questions about their supposed commitment and interest to women's rights, given the bullying and harassment of these actors have had to many female members in this place and indeed to staff who have been engaging with this bill. It's not certainly what I would consider to be feminism or women's rights. Other concerns raised by those who oppose this bill are less about misinformation and I think more about a misreading of the actual substance of the bill. I want to particularly address the assertions by the member for Prospect that this bill will allow nurses and endorsed midwives to perform surgical termination on a woman up to 22 weeks pregnant. This is simply not true. The Minister for Health already dealt with this point in great detail, and I urge members who are still uncertain about this to revisit his contribution if you're feeling a little bit nervous about supporting a Greens bill. But for completeness, I want to reiterate that nothing in this bill permits a prescribed health practitioner from acting outside their existing scope of practice. Amendments made in the other place ensure that this bill is crystal clear and that it is passed Nurse practitioners and endorsed midwives will not suddenly be able to act outside the operation of the Poisons and Therapeutic Goods Act, the Medicines, Poisons and Therapeutic Goods Act, or indeed any other law governing their practice. They will not suddenly be able to perform surgical abortions because this remains outside of their scope of practice. They would simply be empowered to prescribe a medical abortion up to 9 weeks gestation, in line with the TGA guidelines. I want to acknowledge and thank all the members who have been able to engage in this debate professionally and respectfully, and who have focused their contributions on the actual substance of the bill and their experiences in their communities. I'm sure I'm not alone in saying that it has been very powerful to hear and see laid bare the way that members read and listen to the views of their community and weigh those up with their own personal views and then choose how to vote on a bill. I think it has also been particularly telling to hear what kind of tactics work or actually don't work to cause people to want to change their mind in relation to a bill. I want to acknowledge the incredible amount of healthcare workers that have been part of the ongoing and regular conversations that have occurred over many months, sharing the experiences of what it is like to work as a health practitioner in a regional or remote community. I want to also acknowledge, because I think that it often goes unspoken, the incredible, powerful contribution that individual people telling their stories about the trauma that they have been through, the complex choices that they have made, and the really challenging issues that have arisen for them. It is a truly personal issue to make a decision on whether or not to terminate a pregnancy. And while I respect and appreciate that the reality of this situation is that we are having members in here vote on their conscience, I do think it is important to remember that what we are doing with this bill is increasing access and equity. And in doing that, we are empowering the woman who is needing to make that choice to look and reflect on her conscience and what is right for her. In making this bill a reality, we will ensure that more women across this state have access to be able to make that choice for themselves, empowering those women to do that. In this respect, I wish to particularly acknowledge the contribution made by the member for Wallsend, who's currently in the Speaker's chair, and thank her for sharing her experience of seeing the particular challenges for young women in Walgett many, many years ago. She told the Chamber about the privilege that comes with the freedom in that community of having access to a car, something very simple, but that would empower a woman to make the choice that she did not want to see one of the conservative older men doctors in that town and preferred to have the freedom to go somewhere else where those doctors may be more amenable to the healthcare that she would want. I wish to acknowledge that that same level of privilege is not available to all young women in the state of New South Wales, and so changing the law so that we support this bill will increase access and empowerment and choice for them. Making the choice to terminate a pregnancy is already a difficult choice. It is difficult. The member for Bega, who has had extensive experience as a medical professional, put it bluntly when he said that no doctor enjoys performing abortions. I would add to that that no woman enjoys having an abortion. The entire process is already challenging. It is already difficult. It is already hard. And as the member for Wallsend put it so simply, we must pass this bill because we don't want to make it any more difficult. This bill builds upon the hard-won reforms of 2019, which decriminalised abortion care in New South Wales and sought to ensure that our community had safe access to vital reproductive healthcare services when and where they need it. At that time, when that debate was taking place, Dr. Con was indeed not a member of Parliament, but was a practicing doctor, spending her time in Albury, a border community. I had the pleasure during that debate of having messages, emails, enthusiastic encouragement, and various frustrations sent to me by text message from Dr. Con during that time. It is very clear that it is what we are here seeing right now, and indeed from the contribution from the member for Bega also, that having people with vastly different and varied experience becoming members of parliament makes for better laws. That having people that have worked as professionals in regional and rural areas in healthcare is helpful. It helps us make better laws. It helps us pass laws that are indeed better for our communities. It is my hope that we see in the future much more diversity in our parliaments to reflect the diversity of professions and the needs, because when we listen to that expertise, when we hear that expertise and there is the potential to actually debate it seriously, we get so much change, and change for the better. I also want to acknowledge the recently re-elected Senator Mehreen Faruqi from the Greens, who, let's be frank, annoyed a whole lot of people from the left and the right when she made the call to take a stand and give notice of a bill to try and decriminalise abortion in New South Wales. Something needed to tip and push people into action, and Mehreen is known for her absolute determination and steadfast skill in being able to push the boundaries. She pushed those boundaries in a way that made it clear that nobody could ignore the fact that abortion was still criminalised in New South Wales any longer. At the time, people were outraged. People who were pro-choice were outraged. People who were anti-choice were outraged. Mehreen is no stranger to outrage. However, what she did was, I think, played a critical role in a way that I would like to see the Greens regularly play a critical role, and that is to open up a debate, to create a space for people to walk into that is wider than it was before, to push open a window, to push open a door, the Overton window even, and create a bit of space so that people can walk into it and change. We're good at that. But to be honest, this bill is not that. This bill is actually one of the most basic conservative things I've proposed ever in this chamber, because what it does is simply take a recommendation from New South Wales Health to expand access to a service that is already legal in New South Wales and ensure that qualified practitioners are able to do that. I want to finally put an end to this by saying that we must say that in the broader global context, where we see hard-fought rights being eroded by organised right-wing groups to spread misinformation, today in New South Wales Parliament, we can make a difference and go the opposite way to that. I commend the bill to the House.